to Business Success Weekly, where we spotlight successful business entrepreneurs from all walks of life. Today, our topic is curing the cause and preventing disease. Our guest speaker today is a doctor of functional diagnostic medicine, and if you're wondering what that is, then stay tuned, and we'll be right back. Welcome back. Again, our guest today is a doctor of functional diagnostic medicine. He has been on the list of who's who in business professionals. He's a famed speaker, a wellness guru, and the author of Curing the Cause and Preventing Disease. Please welcome Dr. Stephen Ross. Dr. Ross, nice
Thank you, Bill. Thank you, Vitas.
It's a pleasure having you on the show.
Well, it's a pleasure being here. Thanks for inviting me.
You know, Bill, it's a real honor for me to have Dr. Stephen Ross on the show. You know why? I don't know if you knew this, but I was actually an actual patient of Dr. Ross. About 6 months to a year ago, I was in a pretty bad mess. You should have seen me. So it's going to be very fun. I'm looking so forward to interviewing Dr. Ross. So Dr. Ross, although I know so much about what you do and how you cure so many diseases, tell us about your background.
Well, I was trained as a doctor of chiropractic, graduated back in 1982. And most people probably don't realize, but in chiropractic college, we have an extensive education in nutrition, a full year in nutrition, basic nutrition, a year in nutritional pathology.
Wow.
And through my courses of studies in nutrition and chiropractic, I became very interested in more in the area of nutrition. So as I was treating my patients, primarily for musculoskeletal problems, I found that there was a limitation that I was not able to get beyond with my patients, especially those that didn't just have musculoskeletal problems, but they had internal problems also. And that led me to discover what is called functional diagnostic medicine. And functional diagnostic medicine was really coined, the term was coined about 32 years ago. By one of my mentors, Dr. Jeffrey Bland, who was a leader in the field of functional medicine. Sure. And what I realized is that we could go beyond the next step in helping people to heal their chronic illnesses. And that's really what functional medicine is all about, is getting to the root cause. So my studies have continued on extensively in that area, in finding ways to uncover or expose the root causes of health challenges. And what has brought me to today in writing about all my research and studies over the years has, I think, brought about this new era of medicine, or this new approach to medicine, that more and more people are what should I say, accepting or understanding and wanting to utilize.
Very, very impressive. So you have an extensive background on the topic and the subject, and so it's safe to say that you truly know what you're doing. Now, let's get right to the point.
I'd like to think so.
Well, I'm proof of that. Okay, so let's get right to the point. I keep hearing about, although I was a patient of yours, and I know more extensively what functional diagnostic medicine is, but prior to meeting you, Dr. Ross, I keep hearing bits and pieces of the subject on the internet and a couple of people talking about it, but never really grasped the concept. Can you share with us what is functional diagnostic medicine?
Well, functional diagnostic medicine is really a way to scientifically get to the root cause of health challenges. It's really a combination of traditional medicine and complementary alternative medicine. So it isn't complementary, it's not alternative, but it's really an integration of the both.
Okay.
So when we talk about traditional medicine, we look at disease as the enemy. The enemy's got to be destroyed. So the traditional approach is, here's a group of symptoms, here's a diagnosis that we've classified, and now let's start attacking the symptoms. Functional medicine looks at the disease not as an enemy, but as an opportunity for change, an opportunity for growth.
That's interesting to say that. Yeah.
So when we see this diagnosed disease, we ask the question, why? Why did it occur in the first place? And what we see today is primarily what we're dealing with today now is degenerative diseases.
Wow. Yeah.
We're dealing with the diagnosed conditions of Alzheimer's and diabetes and cancer and autoimmune diseases and osteoporosis. And that's really the end stage. That's really the end stage of a condition. So in functional medicine, we ask the question, why?
Sure.
And when we ask that question, we need to come back with reasons of what's happening to your body physiologically. Why isn't your body functioning properly? What is it that caused the body to become out of balance?
Absolutely.
So that's what we explore. That's where we're starting, is at the very core of the root cause.
So you're going way back to the beginning, as opposed to saying, okay, you're diabetic, you have this, here's some medicine, good luck, and see you in 6 months.
Right.
Okay.
Right.
Very impressive.
So not to say that traditional medicine has the wrong approach
Sure.
when dealing with these diseases, but there are other ways to look at it as well.
Absolutely.
Getting to the root cause is based upon doing the proper diagnostic testing. And we're talking about specialized testing to find out and to complement the traditional tests that are being done.
Well,
Makes sense.
today, I mean, a lot of people today hear about holistic health or alternative health. Would you classify functional diagnostic medicine in the holistic health realm?
Not really, because it is holistic in that we're looking at your body as a whole being, as a whole organism, but not in the sense that it's just dealing with herbs and vitamins and lifestyle. That's a part of it, but it's very science-based. So what we're looking at here is science-based laboratory analysis that are looking at how your body is functioning and why it's not functioning properly. So some of the tests we might do would be highly specialized tests to look at gut issues, for instance, doing a specific stool analysis
Sure.
to culture and find out what's going on. Or it might be consisting of saliva testing to look at hormonal imbalances. It might be a hair analysis to look at heavy metal toxifications that you might be dealing with.
Absolutely.
And it could be looking at blood and a number of different specialized tests that do complement traditional medicine, but it's taken it a step further.
Sure.
It's going deeper into the reason of why.
And have you always preferred this sort of alternative, non-traditional type of medicine?
I have, and as far back as I can remember, I've always asked the question, why? If I get the flu or the cold, and I don't get that a lot these days, but if a sickness occurs, I want to know why, rather than, well, just take this over-the-counter medication and let's bring down the temperature
Sure, of course.
and suppress the symptoms. That's all you're doing. You're just covering it up. It's kind of like a red light comes on in your dash, and instead of asking the mechanic why, you say, just take that red light out, would you?
Or put a black piece of tape over
Put a
it.
black piece of tape over it, because I don't like seeing the red light
Sure.
anymore. So traditional medicine has really become very symptomatic in its approach and treatment. And that has always bothered me. 97% of the medications prescribed today are for symptomatic control. So we've gone way out of hand in dealing with these conditions because we're only treating the symptoms in traditional medicine.
Right.
Whereas healthcare today is really being driven by the baby boomers, and the baby boomers are dealing with chronic degenerative diseases.
Oh, absolutely. Absolutely. Now, have you always enjoyed helping people find treatment plans that did not include potentially harmful drugs?
Absolutely,
Great.
and that's one of my biggest concerns is if a patient comes into me with a handful of drugs, which unfortunately they do,
Yeah.
my purpose as their physician, as their doctor, is not necessarily to get them off the drugs. Being a chiropractor, I can't do that, and I don't do that, but rather I'll work with their medical doctor if they're able to work with me, because what we're ultimately going to do is we're going to change the physiology of the body so the body starts working better.
Uh-huh.
And when the body works better, the likelihood of needing these dangerous drugs will decrease.
Exactly.
Now, that doesn't mean necessarily that somebody who is on insulin will be able to eliminate their insulin for diabetes, but they may be able to reduce the amount that they're taking because their bodies will function better.